Well, by now, you have heard of the ivermectin. It is that drug the FDA has approved only for humans to treat river blindness, intestinal roundworms, head lice, and rosacea. It's also the drug, though, that a lot of anti-vaxxers have been pushing around to treat COVID. Now, a group of inmates in Arkansas have given ivermectin to treat the virus. That's what they got. But they're filing a federal lawsuit against the Washington County Detention Center because of how they're feeling. Joining us now is our justice correspondent here at BNC, Candace Kelley. Candace, the rights of prisoners has long been a long-standing debate, often ignored. You hear a lot of people say they have rights, but this one is different. Tell us why.
It's very different because this was a situation where prisoners do have rights. They are supposed to get health assistance and medical assistance, even an operation if they need it. But here, these particular prisoners said that they were given ivermectin against their will, and that they were given ivermectin and lied about it. They were told that they were given steroids or maybe zinc or vitamin C or D, but they were given this by a doctor who has publicly been supporting this drug and really espousing these types of views that are kind of bizarre, that this works. He has a medical clinic that has a contract specifically for this correctional facility in Arkansas. He never told them that he was doing this, and he was really essentially using these prisoners as patients and really lab rats in a sense to figure out and see the results, and taking great and copious notes about how ivermectin would affect them once they took it. Now, if we think about this drug, as you said, it's normally used for parasites and on livestock, and the side effects of it can not only be comas and vomiting or nausea, but death. So this is something that has made its way to the courts by way of the federal case, and they're filing for a violation of equal protection and due process because they were lied about this drug.
Candace, I date back to when they gave LSD to soldiers back in the 1950s unsuspectingly. We also know about the Tuskegee experiments. Does this fit into that category, and does this lawsuit have legs?
This lawsuit definitely has legs, and this lawsuit definitely fits into this category. Here you have essentially this doctor who, by the way, was getting these meds at a wholesale price. So he was using them for a number of reasons, and actually needed the numbers from those hundreds of prisoners to actually buy this wholesale and then use it in the way that he saw financially fit for him. So he was benefiting from it, but he was also taking notes. He was also making sure that he monitored them to see what types of effects that it had, because at the end of the day, nobody really knows. So why not take this group of prisoners who are together in a special set of circumstances and see what the drug does to them? This really does speak to and remind me of the Tuskegee experiment, because we're talking about people who are brown and black. We're also talking about 2/3 of this population. They're just pre-trial detainees. They haven't been convicted of anything. So they're there, no convictions. They're just waiting trial for one reason or another. Maybe they can't make bail, but they haven't even gone through the full process of the court system. Not that anybody deserves this, but people are in there because they just don't even have the money to get out. And they too were subject to these types of due process violations, according to this federal lawsuit.
Candace, there is the lawsuit, and then there is the doctor himself. And I'll take it outside of the prison system and put it this way. What if someone was doing this to your mother, your grandmother in a nursing home without their knowledge? What is happening, if you know, criminally to this particular doctor, because he did seem to be misleading these inmates about their treatment?
Yes, and at the end of the day, this could be some type of an assault. I wouldn't be surprised if those types of, I guess, accusations would be coming forth. What they are asking for in this specific case is they want full medical treatment to be evaluated by someone besides this Dr. Robert Karras, whose medical facility is the one who's been overseeing these patients. They also want to make sure that this never happens again. But as you said, it seems like this rises to a criminal level, and that their bodies were used in a way that benefited him against their will. And anytime that you interrupt somebody's person and body, it can rise to the level of invasion of privacy or some type of criminal assault on this level. But here, for these federal charges, when it comes to their civil rights, this is why this was filed in this particular court. However, I would not be surprised if more charges would be coming down the pipe, like you said.
Candace, I'm curious, I've got 30 seconds left. Are you convinced that what is criminal in Arkansas will be, or what is criminal rather in Washington or New York will be criminal in Arkansas?
Short answer is this: the way that the attention has been, like light has been shined on this particular case, I think so. The fact is that nobody really knew this doctor was doing this until it was reported about, and that alerted the inmates that, hey, these are drugs that we thought was one thing, and it's actually Ivermectin. And now that the light is being shined on the case, as we've seen in so many cases across the country, the attention is there. And because when we give attention to these cases, we often, or more than likely, or hopefully end up more on the side of justice because people are paying attention and there's more accountability.
And we are paying attention and will continue to follow this story. Candace Kelley, great to have you on the show.